Hypoglycemia is an insufficient amount of blood glucose, meaning that you're not getting enough glucose to your noggin. Your brain needs two things. It needs oxygen and it needs glucose. And if you provide or prevent it from getting either of those, you're going to have problems. Oftentimes we'll see diabetic patients who wake up in the morning and they're late for their dental office, for their dental appointment, and they take their anti-diabetic medication, whether it's insulin or an oral anti-diabetic med. They take that because they're used to taking it every morning, and they run out the door and forget to eat breakfast. And by the time they hit the dental office, they're hypoglycemic. The gold standard of care to determine if somebody has hypoglycemia, not one of the other differential diagnoses that I listed on the former screen, is to do a point of care finger stick and measure their blood glucose. Here is the algorithm for hypoglycemia. Once again, you stop your emergency or stop your procedure immediately. You call for help. You're going to place the patient in a semi-reclined position to make sure that they're not, just to make sure that they're getting as much oxygenated blood to their head. And you're going to perform a blood glucose test. Like I said, getting a point of care finger monitor is easy to do. Once you take that blood sample and put it into the monitor, if they have a blood glucose level that's less than 75 milligrams per deciliter and they're conscious, then you can administer oral glucose paste that we'll talk about here in a minute. If they lose consciousness, you definitely need to call 911 immediately. You need to maintain their airway so that they don't obstruct. Give them some oxygen. So once again, that the oxygen or the blood that's getting to their head is rich in oxygen. It is really, really important that you don't stick glucose gel or glucose tablets or cake frosting or whatever it is that you're using for a hypoglycemic patient. You do not stick that in a patient's mouth who is unconscious. And the reason why is because sticking anything in the mouth of an unconscious patient can be aspirated into the patient's lungs. And now all of a sudden you've got a hypoglycemic patient who's also aspirated, and that can be life-threatening.